Does your shoulder hurt on movement? It may be frozen shoulder, also known as adhesive capsulitis, a painful inflammatory condition characterized by stiffness and loss of motion in the shoulder joint. This condition can significantly impact a person's daily life, making simple tasks like reaching for objects or getting dressed challenging and uncomfortable. The condition typically develops gradually, with pain and stiffness increasing over time. As the condition progresses, the shoulder joint becomes increasingly restricted in its range of motion, affecting both active and passive movements. Know the causes and risk factors. The exact cause of frozen shoulder is not always clear, but several factors can increase the risk of developing this condition. Age and gender. People between 40 and 60 years old are more likely to experience frozen shoulder, with women being more susceptible than men. Medical conditions, such as diabetes. Individuals with diabetes have a higher risk of developing frozen shoulder. Other medical conditions like thyroid disorders, heart disease, and Parkinson's disease have been associated with an increased risk of frozen shoulder. Immobilization of the joint. Prolonged immobility of the shoulder, often due to injury or surgery, can lead to frozen shoulder. Rheumatic diseases. Chronic conditions like rheumatism or arthritis may contribute to the development of frozen shoulder. In some cases, frozen shoulder can occur without any apparent cause, a condition known as idiopathic frozen shoulder. Recognizing signs and symptoms of frozen shoulder. The symptoms of frozen shoulder typically develop in stages and may include pain, a dull or aching pain in the shoulder, which often worsens at night or in the morning. Stiffness, gradual increase in shoulder stiffness, making it difficult to perform everyday activities. Limited range of motion, difficulty in moving the arm, especially in certain directions like raising it or rotating it outward. Worsening pain with movement. Attempted motion can exacerbate the pain. If you're experiencing these symptoms, it's essential to consult a healthcare professional for an accurate diagnosis. Stages of frozen shoulder. Frozen shoulder typically progresses through 3 distinct stages. Freezing stage. This initial phase can last from 6 weeks to 9 months. Pain gradually increases, and shoulder movement becomes more restricted. Frozen stage, lasting 4 to 9 months. This stage is characterized by a slow improvement in pain but increased stiffness. The shoulder's range of motion is significantly limited during this period. Thawing stage. The final stage, which can last from 5 to 26 months, involves a gradual return of shoulder motion towards normal. Pain continues to decrease during this phase. Understanding these stages can help manage expectations and guide treatment approaches. How to diagnose? Diagnosing frozen shoulder typically involves various aspects. Physical examination. A healthcare provider will assess the range of motion in your shoulder. Medical history. Your doctor will ask about your symptoms and any relevant medical conditions. Imaging tests. X-rays or MRI scans may be used to rule out other conditions and confirm the diagnosis. How to test whether you've a frozen shoulder. 2 specific tests often used in diagnosing frozen shoulder in clinic or home are scratch test. This evaluates your ability to reach behind your back. Lateral external rotation test. This assesses your shoulder's ability to rotate outward. Treatment options for frozen shoulder. Treatment for frozen shoulder aims to reduce pain and improve shoulder mobility. Options include medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce pain and inflammation, and corticosteroid injections for short-term pain relief, physical therapy, like stretching exercises to improve flexibility, strengthening exercises to build shoulder muscles, surgical interventions. In severe cases, procedures like shoulder manipulation or arthroscopic surgery may be considered home care, applying heat or cold packs during flare-up of pain. Loosening the muscles around the shoulder with gentle stretching exercises. Remember, treatment may continue for several months, and there's no one-size-fits-all approach. So managing frozen shoulder in daily life can be challenging. Here are some tips. Maintain good posture to reduce strain on your shoulder. Use assistive devices for reaching and dressing if needed. Modify your workspace to accommodate your limited range of motion. Practice stress reduction techniques, as it can exacerbate pain. Alternative therapies of benefit. Some people find relief through alternative therapies like acupuncture, yoga, homeopathy, and Ayurveda. Homeopathy treatment is beneficial, as it produces deep healing in the shoulder tissue, reducing stiffness and increasing the range of motion of the shoulder joint. While these therapies can be helpful, It's important to consult with a healthcare professional for complementing treatment, preventing the frozen shoulder. While not all cases of frozen shoulder can be prevented, you can reduce your risk by maintaining good shoulder flexibility through regular stretching and staying active and maintaining a healthy lifestyle. Managing conditions like diabetes that increase your risk. When to seek medical help. If you're experiencing persistent shoulder pain or stiffness, it's important to consult a healthcare provider. Seeking prompt treatment for shoulder injuries will reduce the flare-ups. Seek medical attention if your symptoms persist for more than a few weeks, pain or stiffness interferes with daily activities. Early intervention can help prevent the condition from worsening and potentially speed up recovery. Remember, while frozen shoulder can be a frustrating and painful condition, with proper care management, most people experience significant improvement over time. Don't hesitate to reach out to healthcare professionals and opt for homeopathy for guidance and support throughout your recovery journey.